With any sort of injury, I feel like my skill set is being able to evaluate the patient, getting a history, doing an exam. I also use ultrasound, which provides me with an ability to do some diagnostic imaging in office, aside from just an x-ray. An x-ray is good for looking at joints and looking at the bones. However, there's plenty of injuries when it comes to bursitis, tendonitis, things like that aren't going to show up on an x-ray. And so my ability to use the ultrasound and kind of diagnose some other things that could be presenting issues for the patient is also very helpful. So I see everything from, hey, I sprained my ankle, so ligament injuries, tendon injuries, acute injuries like fractures that are non-operative, arthritis, things that are more chronic but are not necessarily in need of total joint or surgery. I can help provide ultrasound-guided injections. And nowadays there's a lot of different options rather than just what most people think of as cortisone. There are more options available, and I'm able to offer that to these patients to keep them going. In the event that it is something surgical, I inform the patient, I help them understand what's going on. Do we need to get an MRI? We have people here that I would refer to, and they would be in great hands moving forward if they need any kind of surgical intervention. It's not easy when a patient is having pain. When we get them going with physical therapy, for instance, we're not just working on building strength. We're trying to functionally get them moving better. For sure, when a patient comes here and I say, hey, we have therapy right downstairs, it's also nice in the fact that, if I ever needed to, I can go downstairs and talk to the therapist myself, and we can all kind of close the loop, so to speak, as far as each patient's concerned. And at the end of the day, the goal is to help the patient get back to a level of health that brings them quality of life. That's the ultimate end goal.